This is an overview of the Clinical Outcomes Radar, which is located in the CAM COVID Analytics app on the CIPHA platform. The Clinical Outcomes Radar has a number of objectives. Firstly, it is to build a real-time admission and population data dashboard. It shows clinical data for organisations and population demographics. It allows an acute provider and CCG comparison. All indicators are mapped at patient-level detail to enable clinical outcome differences to be monitored for different demographic groups. And the user interface is designed to be used directly without the support of analysts. Therefore, key to the design will be speed and simplicity of navigation. All of the indicators that have been chosen within the Clinical Outcomes Radar have been selected by a group of medical directors from secondary, community and mental health providers across Cheshire and Merseyside. In the first version of the Clinical Outcomes Radar, there are a number of different indicators available, such as sepsis, hospital admissions for sepsis, hospital admissions for COPD exacerbations, AAAs with rupture and without rupture. These have been split because of coding differences across the region's hospitals. CKD5 requiring dialysis events, myocardial infarction requiring a PCI, asthma exacerbation admissions, alcohol-specific admissions, diabetic disorder admissions, in-hospital deaths, hospital emergency admissions, falls resulting in hospital admissions, physical health checks for learning disabilities citizens, usage of antidepressants recorded in primary care, smoking interventions, use of the Mental Health Act, count of Section 2 or 3, psychosis diagnosis and physical health checks for serious mental illness. Each one of the pages is exactly the same and they have the number of different metrics on them. The first pane looks at the current year versus the previous year's activity. For any of the outcomes which rely on clinical coding from acute trusts, currently these outcomes will only rely on SUS data due to differences in quality of coding in the live hospital feeds across the region. Some of the hospital outcomes indicators, however, use the up-to-date data, such as hospital emergency admissions, which use the live HL7 data to give you a more up-to-date picture across the region of what is occurring. Some of the indicators also use primary care data, such as usage of antidepressants. To explain the indicators are in here based on the population, we use the main demographic influences in the population. The charts are simple to understand. The purple bars represent the size of the population in general, and the blue bars represent the use in this case of percentage of antidepressants in females. What you can see from this chart is that according to the data, men using antidepressants or being prescribed antidepressants as a medication is lower represented in the population than females who are overrepresented according to the size of the population. Ethnicity shows the breakdown of ethnicity and the same sort of analysis by gender, as does the age range, where we see a large peak between the 50 to 59-year-olds. And in terms of the deprivation quintiles, we also see that the most deprived citizens living in the most deprived quintiles of the population are overrepresented. We're also able to see a heat map, which represents where there are less or more use of rates per 100,000 per 1,000 in the population, and rates per 1,000 by CCG across Cheshire and Merseyside. I hope that has given you a good understanding of the clinical outcomes radar.